Miss Ng, I am student nurse Esther and I'll be assessing your wound today. How are you feeling at the moment?
I'm fine, thank you.
Okay, alright. Is it okay if I assess your wound now?
Yeah, sure.
Okay. There's been a lot of news ongoing about the number of nurses that have resigned and many nurses that have faced burnout. So I do have fears if I were to enter the profession and I do face burnout as well. But I tell myself that I would enter this profession with a positive attitude and take it as a way for me to build my resilience. So I'm still looking forward to be a nurse. I'm Esther and I'm a Year 2 nursing student at NUS. I decided to go into nursing after a random conversation with my dad in the car, and it was during COVID times. Near May 2020, I was the first pioneer batch of COVID nursing students. The nursing program had to change and adapt because of the COVID pandemic, and I would say that I am very thankful for resourceful and adaptable nursing teaching team. So what they did is they incorporated Zoom classes and also online clinical simulation programs. And even this year, we got to try the VR sets and do hands-on to compensate for the loss of lab classes or clinical practice that we did not get because of COVID. We only went back to school once a month for the lab sessions, the hands-on sessions on how we do injections, how we do wound cleaning, which are skills that we are unable to learn online. Okay, so today is the last lesson of our semester and it's a roundup of everything we've learned. And today we'll be putting it into a clinical simulation.
Say practices, what do you mean? These are the few basic ones. Two identifiers.
Now COVID is a norm. The lecturers have also very honestly told us that we will be in touch with COVID patients whether we like it or not. So we will still do our due diligence to make sure that we take care of our own safety and our health by wearing our mask properly, doing the hand hygiene, making sure that the basics are met before we go into clinical setting. One of the challenges that I faced was the reduced clinical hours because the hospitals were struggling with the high patient load. There are a few of my friends that felt less confident and competent as a nurse because there are some skills, for instance, learning about human nuances, how to assess patients when they are in pain. And these are skills that we can only learn when we are on the ground. One of the beautiful things that has came out of COVID, we see the resilience of nurses and even my classmates as well. How resourceful and adaptable we can be in such challenges. And for us students, we have learned to adapt and accept that yes, COVID is around, but we can still excel as students. So I'm thankful that I have a study buddy that we study regularly and that has kept the motivation to study high because it can be tiring and lonely at times to study by yourself at home. We so on, like you ask me questions first, then I answer, then you ask me, hey, you want to go out for kopi or not? Then we went out eat ice cream first, remember? We met at Premier eat ice cream, then after that we say, hey, since we both struggling, then we study together. I think it was your idea. One way that the public can support nurses and healthcare professionals is to be self-aware of their symptoms. If let's say you have COVID, to not go into the A&E department immediately, but to visit your general practitioner. This would definitely help to lessen the patient load. And for people who frequently use social media, to be mindful of what you post. We as nurses and healthcare professionals are doing our very best to help you and support you. And your efforts in accepting us, in acknowledging us goes a long way to help us fight this COVID battle together.